Pregnancy is such a special time full of excitement and anticipation. However, during this coronavirus, there are so many new fears and anxiety for all of us, but especially for pregnant women. I want to help keep pregnancy as happy a time as possible. So let's review some questions so we can help you feel a little bit more prepared and less anxious during this uncertain time. Very limited research has not shown that pregnant women are at any more increased risk than other groups of people. However, due to changes in their bodies and immune systems during pregnancy, especially in the third trimester, women who are pregnant do need to take extra precautions. We know that they can be at risk for other respiratory infections, which could mean that coronavirus is a risk as well. We recommend that pregnant women all avoid contact with anyone who could be exhibiting symptoms of the coronavirus, such as trouble breathing, coughing, or fever. Additionally, we continue to recommend that you avoid any sort of public gatherings, large or small. We hope that you'll continue maintaining social distancing whenever you're outside of the house, even with close friends and family. And of course, always wash your hands frequently and well with soap and water. Also, make sure you're cleaning all touch surfaces throughout your home and continue to monitor yourself for signs of the coronavirus. Yes, although we understand it can be scary to visit a medical clinic during a pandemic, there continue to be important benefits to you for receiving prenatal care during pregnancy to keep you as safe as possible. And we want you to know we've made important changes within the clinic to keep it as safe as possible for you. We are requiring that employees and patients wear a mask in the clinic. We've also asked all employees who don't need to be present to work from home. Also, we are maintaining social distancing in all waiting rooms and within the clinic as much as possible. Additionally, we have increased cleaning guidelines for all work areas throughout the clinic. Do check with your OBGYN regarding your appointments. Although many prenatal appointments require you to be present in the clinic due to ultrasounds or lab draws, there are some that could be transitioned to a telemedicine visit. After your child is born, it is important for you to continue to seek professional medical guidance after delivery, both for you and for your newborn. Your legacy providers have already given this a lot of thought. Please reach out to us so that we can help you schedule these important post-delivery appointments either safely in the clinic or via telemedicine. When we are anxious, it is helpful to make a plan so that we feel more prepared and know better what to expect. We want you to reach out to the hospital or to your provider so that you know exactly where to go within the hospital. This way, you'll be avoiding any unnecessary exposure to other units. Also, talk to your provider about new COVID restrictions and guidelines, which are changing frequently within the hospital. For example, how many visitors will be allowed in the room, and will you be recommended to wear a mask? It's also very helpful to think ahead and make a list of all the things your newborn and you might need after delivery. Your newborn may need pacifiers, bottles, and also plenty of diapers and wipes. Even if you plan to breastfeed, it would also be really helpful to have formula on hand. You will need feminine hygiene pads and supplies for breastfeeding or pumping. By thinking ahead about all of these things and making sure you have these necessary items in your house prior to delivery, this will relieve some anxiety you have and will also help avoid any unnecessary trips to the store after delivery. There are lots of stretching and breathing exercises that are safe to do in pregnancy and can be done at home that have been proven to help relieve anxiety. Also, go on a walk and connect with nature. This is tremendously helpful for stress and anxiety. Also, it's always important to maintain a healthy diet and to get plenty of sleep and rest at night. This also will help you feel healthier and more relaxed. Lastly, please be aware that there are behavioral health services available for you at Legacy. If the items mentioned above don't help you feel better, or your symptoms of anxiety or even depression become significant, please reach out to your OB provider so that we can refer you to a behavioral health specialist. There's truly no question that is off limit between you and your OBGYN provider. It is your right to ask any question that will help you better take care of your body and your baby. Some good questions to ask could be about how the COVID-19 pandemic will affect visitor policies at the hospital, or even visitor recommendations for your newborn when you're back home so that you can prepare family and relatives. Please feel free to get in touch with your Legacy OBGYN provider with any further questions about the COVID-19 pandemic, pregnancy, and anxieties or fears you might be having. We are here for you, both in the clinics and via telemedicine visits on your computer or phone.